Safety 365.
Welcome back to Safety 365, where our goal is to help you navigate more safely through your daily activities and understand the importance of taking proactive measures to safeguard yourself. Happy to be back here in New Year 2023. We're going to kick it off. Today's show sponsors are Bolo Stick LLC, the door barricade device, and Threat Extinguisher. Don't just see a threat, extinguish it. Happy to have with me a longtime friend and a physician, a surgeon, Dr. Pat Patchen. Pat, thanks for coming in.
Glad to be here, Bill. Thanks for having me.
A little bit about Dr. Patchen here. This guy's been around for like more than 3 decades, cutting on people and taking out gallbladders and such. He pretty much a lot of expertise there in the medical field. He started out, he graduated from Sidney Kimmel Medical College at the Thomas Jefferson University in 1989. Yes, he is a spry 50-something. He served his residency at Mercy Hospital in Pittsburgh and is formerly affiliated with Hillside Rehab, St. Joseph Hospital, and Trumbull Memorial Hospital. Pat, did I miss anything?
No, when I went to medical school, it was actually called Jefferson Medical College. Sidney Kimmel, whoever that is, bought it out at some point. So
well, there you
it's
go.
Just a difference of the name. Everything changes, and with medicine, the hospitals
Doggone this Wikipedia. I don't know what I'm going to do. I'm totally
get together. This one buys that one. Even Mercy, where I trained, isn't independent
right.
anymore.
It was TMH for as long as I've known it, and I just kind of thought that I'd go with that one. That's what most people are familiar with. And
I still call it TMH.
What is it now? Regional Medical?
Steward Healthcare.
Steward Healthcare. That's right. I should know that. I had a brief stint with
I still
Coleman
call it
Professional.
TMH.
Yep, everybody knows it.
That's where I started in the 90s. So
90s. Wow, I was still carrying a revolver on duty. We're that old. So anyways, today we're going to be addressing the topic of COVID-19. Seems to be the never-ending threat. I think we both know why.
Well, something that is different. You know, most people aren't old enough to have ever been through a pandemic. The last really bad one was probably back in like 1920s, the Spanish flu.
I was thinking the Legionnaires thing.
It did, but
Didn't
that
really become
wasn't,
pandemic. That was centrally
nothing
located.
like this. We're
Yeah.
talking where millions of people died. Then you
Right,
got to go
right.
back a few years. And
Right.
what's interesting is back then with the Spanish flu, that killed 35 million people. I mean, we're nowhere near that with COVID, believe it or not. Worldwide, we've lost I think around 7 million people
And
worldwide.
Bet you if we went into our high schools and asked anybody about the Spanish flu, they'd never heard of it.
If they did, they probably thought it was something else.
Yeah, I mean, I've heard of Spanish fly. That was something totally different.
Exactly.
But that was just college. Okay. So we're going to be lighthearted here. We're going to get our
Okay.
viewers going. Hey, so anyways, this COVID thing, it's been around for a while. I think I may have had COVID before they called it COVID. I mean, it knocked me down for 5 or 6 days.
A lot of people did. They
And-
probably had it and didn't know it. And they're estimating probably double the number of people in this country they've documented have it. They're saying we're just over 100 million people in the United States have been documented to have it. And they're estimating probably 200 million people have had it. It's just not getting reported or people aren't getting tested.
Right.
But
I think it was
probably
more when people
a
went to
lot
the
more.
hospitals. That's where they're getting all their data.
Also,
They were using
the
that.
other thing there's a lot of confusion is someone had it twice. Well, are they counted twice or they counted once? And it can get very confusing when you start looking at the statistics.
What makes the most sense for our billing practices? Yeah. Anyway, I mean, that's further down the road here. But anyways, let's just start off with this. Why and how did we get here? That's a multifaceted approach to looking at this. But I'm looking at 2020, January 21st, the CDC confirmed we had our first coronavirus case here in the United States.
Okay.
That was January 21st. 12 days later, on February 2nd, global air travel is restricted. Okay, you're not allowed to travel outside the country, blah, blah, blah. The next day, February 3rd, the U.S. declared it a public health emergency. And then on 36 days later, on March 11th, the World Health Organization declares COVID a pandemic. Wow. I mean, our lives all changed. Everything as we knew it, from talking with friends, meeting with family, sending our kids to school, changed dramatically. Even economics in our country changed. I mean, when you couldn't find toilet paper, it was a premium commodity.
Still can't figure that out.
I don't get it either. But I mean, people are just they worried. They were scared.
They panic.
They were what's the Orson Welles The Invasion, the movie Orson Welles
Invasion of the Body Snatchers, or the War of the Worlds.
War of the Worlds, where he came out and
Yeah.
everybody thought it was real on the radio,
Mm-hmm.
and they were in a massive panic. That's kind of what happened.
It did. There was a lot of panic, and panic comes from fear of the unknown. And even the people that were supposed to know didn't know. It's not that they didn't want to know, you couldn't know. This was something different.
We've got to learn this. We've got to learn this. And there were mistakes made along the way, absolutely. I think even though mistakes were made along the way, I think some things may have been exacerbated one way or another, or could have been corrected and mediated a little bit better. But
Depends on your perspective with that, Bill. I was in
sure.
practice for 27 years, and I don't ever remember someone parking a refrigerator truck in the parking lot to bury all the bodies that the morgue couldn't hold in the hospital.
Yeah. I
Okay,
had a
so
buddy who was.
That is no exaggeration.
Gotcha.
I walk past that thing every day,
Gotcha.
and there's, in 27 years, I never saw anything like that. You know, when I was just starting my medical career, AIDS was the big fear. By 2030, 45% of the country was supposed to be infected with HIV because there was no cure, it was attacking our immune system and everything else. And look where we are with that now. We've got medicines to control it, people live with it, people
Well,
are
they're
still dying from it.
They're
okay?
advertising them on TV.
But that was the scare then, because we didn't know anything about it. We didn't even know how people were getting it. Then, you know, you figured it out. The biggest problem with AIDS was, unfortunately, the people that were getting it were IV drug users and homosexuals, and there was a tremendous amount of inappropriate feeling about that segment of our population.
Sure. Well,
So
that's
people
what we
said,
do.
what are we going
Yeah.
to save these people for? Which is a horrific way to think about it, but to
So
say
along
that
those lines, you know what? And I'm gonna just reach out here. When they first came out with Narcan, for everybody was overdosing from fentanyl and heroin, and I was a police officer. You know, in my stoic mind, you know, I was so reptilian. Are you kidding me? They want to choose to do drugs, and I got to go out there and save them. But you know what set me straight? When my partner asked me, "What if it's your kid?"
exactly,
And you
Bill.
know, and it made perfect. It was a knee-jerk response as a police officer, but at the same time, it flipped the script for me, and it's like, you know what? Open up your mind.
Used to get the same thing all the time with surgery, with trauma patients. People come in, they're gunshots, you know, they get shot, and they come in, and you know, most of the time, trauma happens to bad people doing bad things. But you know what? You fix them up, and you sort that all out later. That's
Yeah.
not. You take care of the problem. Then, when that all unfolds later, okay. But
You know
that's
what?
that's not what I'm here for.
No.
Okay, that's what you're here for.
Right,
You
no.
got to come in after. I'm going to fix them up. And if they did something bad,
Right,
and someone
right.
proves they did something bad, and then there's something else that needs done about that.
And we hook them up, and now it's out into the
Okay.
courts and the legal
Okay,
system.
but I can't.
Yeah, no, you're right. You're right, Pat. This is going to be a good segment. I can tell already. We're not even into past the safety question yet.
Yeah.
So anyways, before we get too in depth on this, let's get started with our next segment. I like to call our safety question of the day.
Okay.
Just a little riff I laid down there.
Okay.
Yeah. I can only wish to play an instrument. So our safety question today, pretty relevant. What was the average cost to hospitals per patient for PPE in 2020?
2020. Oh, I couldn't even begin to tell you what
You
that
brought your notes, so I kind of thought you'd have
I always
something
had
in
some
there.
numbers about numbers, percentages of how much of this is going on, where we started, where we are today. As far as the healthcare costs, you're going to find a lot of skewed data on that.
Gotcha.
I know of, you know, they changed reimbursements because of COVID. As far as the PPE was a huge problem initially because what we were being required to do, there just weren't the supplies to do it.
Right. Well, this will serve purpose. So during the pre-pandemic baseline period, second and third quarter of 2019, hospitals typically spent a little over $7 per patient for PPE. So this is like pre-COVID emergence coming on. After that, it skyrocketed to $20.40 during the spring of 2020. So nearly triple. I mean, this COVID thing, boom, it hit. Now everything's PPE. We're hand sanitizers. We're masking. We're gowning. We're doing everything we can
Yes.
possibly do
Yeah.
to reduce the spread of this thing, and it nearly tripled the cost. I mean, it's law of supply and demand, right?
Well, it had to, plus you needed to have more supplies. You have to realize we live in a fortunate country where most of our protective wear, it's disposable. You use it once and throw it out. You use a
Sure.
mask and throw
Sure.
it out. You use a pair of gloves, you throw it out. There are countries where that doesn't happen. We send tons of sterile supplies in the operating room that are open and not used, and we send them to other countries. There's boats that go to places to
Wow, I
take
never
care
knew
of people.
that. That's
oh
crazy.
Yeah. Oh yeah,
Okay.
the hospitals all contribute to that stuff. But now all of a sudden we're reusing things. First of all, it wasn't designed to be reused. And that creates an issue in itself with respect to even the safety or efficacy of a mask that wasn't supposed to be used more than once. And now I'm using it 3-4 days in a row, not to mention what it's like to breathe your own breath for 3 or 4 straight days through a mask.
Right on.
But that's what happened, and it was a necessity because we're going back to that fear of the unknown thing. We didn't know what this was, and we didn't know how many different ways you could get it. We assume since it's mostly a respiratory problem, it's transmitted that way. Someone coughs or sneezes on you, you use the same utensils, that you're going to get it. But they started finding it in people's tears. They started finding, we just didn't know. We didn't know everything. You didn't know how effective is it. Okay, you have some viruses. Just going back to the AIDS thing again. AIDS is not a very infective virus. Okay, if you had AIDS and I drew your blood and I stuck myself with the needle and you actually have it, my risk of getting it is about 1 in 200. It's very, very,
Wow.
very low.
Wow.
You really
Not how it was reported, that's
no,
for sure.
that's just it. But coronavirus, when this started out, they were saying if someone had it, they would transmit it to they would transmit it to 2 to 3 people. And now these newer variants that are coming out now,
Oh, yeah. Yeah,
they're
they're-
saying they'll transmit it between 10 and 18 people, one person. So it's more infective, but it's not killing people like it did when it
It
first came
seems
out.
like as these strains came out, they were less lethal.
It is. Then you're going to find there's probably more than one reason that's happening. A lot of viruses, when they go through this mutation process, which is basically an evolution process for a virus, sometimes the mutations produce a stronger strain, one that's more infective, that's more dangerous. Sometimes they produce a weaker strain. Sometimes they produce a strain that you'll never even see because it dies out before it does anything. Viral mutations happen about like 1 out of every what we call 20 million replications, which means the virus mutates to something different. Something in its genetic material changes. It may never be anything that happens. The mutation, it may not survive. Or it might survive. And then if it survives, you don't know, it's not going to be the same as the mother, so to speak. But how bad it is, how serious it is, that's the unknown factor. Now, with everybody, now we have medications that they've been able to treat these viruses with. Now people have been vaccinated. You're throwing that into the mix. You've had people that got infected, which offers them some immunity, but not all immunity. Same with the vaccine, some immunity, not all immunity. You're mixing all that together. So we're comparing apples to oranges with respect to what do you do now versus what we did then.
Right.
You know what I mean? And we're also dealing with a completely different situation, both from the standpoint of the virus itself and from the standpoint of the creatures it's infecting, because we're a different population than we were 3 years ago when this started.
Sure,
I mean,
sure.
no question.
Sure. I think there's been a cocktail of vaccinations
Absolutely.
put together, and everybody's trying to do their best.
We're
you know,
still only at 2/3 vaccinated in the United States.
Yeah.
Only 2/3. There's a third of people are not vaccinated for whatever reason.
Right.
A lot of them are in the younger populations, the little kids and stuff. I mean, there's that counts, and that's a reasonable hesitation. I kind of joked when this vaccine first rolled out, first people they wanted to give it to were the healthcare workers. And they said, we're going to lead by example. We're going to show you that this is a safe vaccine.
What if
we
there's
really were
something bad?
is we were actually saying we are the guinea pigs.
Yeah,
okay,
yeah,
we
yeah.
need it because we're taking care of the people that have this
Well, and first
illness.
responders, too. They wanted to give it to
Absolutely.
first responders.
People who are going to be in most danger of getting the virus get the vaccination first. But honestly, you're also the guinea pigs. Is it going to work or not? Is it going to make you sick?
What side effects are going to come with it?
Right. And
We didn't know that.
I got my series. I personally did it. I didn't really have any. I think I got a headache one day. My partner had it the first round, nothing. The second round, he shook his bed all night long with chills and fever of
Yeah.
104. It depends. It was a highly variable situation with respect to the side effects people got, but I think it was a kind of thing we had to do something. You couldn't wait and go through the traditional DEA regulatory. If you introduce a drug today to the DEA and you want it to start being tested, average time for it to hit the market, if it's done correctly, is between 10 and 15 years.
It's too late. Damage is done, and this is. I think that's
couldn't
some
do
of the
that,
problem
and
with our United States FDA approval and safe. Listen, sometimes I think you gotta throw it at the wall and hope for the best,
And
especially if
I
it's in a
don't-
pandemic type situation.
I don't disagree with that. And as I said, I got the vaccine. Okay, when people ask me, "What do you think?" I tell them, "I got it." Okay, if there's something out there that could protect me, I'm going to try it.
All right, hold that thought, because we're going to get way more in depth on that.
Okay.
It's kind of we started stimulating a little conversation here, and there's more down the road here, and I'd like to get into that a little deeper. But first, we're going to go to the next segment called "You Don't Know What You Don't Know."
Well, I think that applies here quite a bit
Yeah.
because you don't.
All right, you don't know what you don't know, and for most of us, we don't know anything about this. And I did some studying up, and obviously Pat's definitely researched it himself. As of September 26th of 2020, the hospitalization rate in the United States due to COVID-19 was the highest for those aged 85 years and older. Okay, makes sense. You're older, your immune system's not as good. You're gonna have more things that can go wrong and be more susceptible to viruses and stuff that are out there. So that made sense to me. Per 100,000 population, we hospitalized between 0 and 4 years, 18.4 per 100,000.
Okay.
So what is that? 0.0001% of that age range. 5 to 17 years was 10.6. 18 to 29, 78.5, and it goes up as age increased. It seemed like the hospitalization rate increased.
That would probably be. I mean, I'm sure that's accurate. I don't know the numbers off the top
and
of
it
my head.
stands to reason. Kids have better immunization, a better response, immunity to things.
It depends.
Well, unless they're vulnerable.
Well,
right?
no, with pediatric illness is very, very different. It just is something as simple as chickenpox. If you get it when you're a kid, there's no problem. If you get it when it's an adult, it can be fatal.
Sure.
Okay,
sure.
so kids' immune system is different than adults. If you remember when this first came out, the kids weren't really being infected. They weren't getting sick.
Right.
Yeah, they are, but the rates are much, much lower.
Much lower than somebody our age range or even
Again,
older.
Why? Still don't have a good answer for that. None that I've heard.
Maybe because the kids are exposed to so much. Pat, I can only tell you this, and I've said it in my other episodes. When I first became a school resource officer, a teacher came to me and said, "Your first year, you're going to get sick so much that you're not going to believe it. Second year, not as bad. Third year, you're pretty much going to have seen everything." And it was so true, because the first year there knocked me on my can.
No question. I can't tell you how many times. I'm the same way. Okay, I worked in a hospital. I was
Yeah.
exposed to everything. I can't tell you how many times my whole family got sick and I didn't. I never got sick. I wound up taking care of everybody because I was the only one that didn't get it. Because I was
you were exposed to everything on a
exposed to
daily
so
basis.
many
Yeah.
things. Yes,
And I
there
think
is
that
something.
There might be something to that with the kids not catching this corona
true.
as heavily as everybody else.
Right, and when kids start school all the time in the fall, or you put your kid in daycare for the first time, they get sick. I mean, it's just what happens. It's a new environment. When you change an environment, you change everybody's little microbes they're carrying around, and
Gotcha. So this said, I mean, by my research, 0 to 17 years, 0.1% were hospitalized in that age range.
makes sense.
Okay, so they were robust, I guess, in their immunity to this, at least at first, unless they had underlying issues, and that's
Right.
what would get them to the hospitalization rate. So they were pretty well okay.
You're correct. The younger people
But
did
yet-
seem to have more of an immunity to this than
But
the
we
older
ran
people.
scared and we closed our schools to for a population of kids that weren't getting infected at a higher rate as the adults. And we closed down our schools and did them more harm than good over the long span.
Oh, I agree with the homeschool or the remote learning being detrimental to the kids. I totally agree with that. With respect to closing the schools down, you know what a carrier is? A carrier is someone that has the infection, but
Sure.
they don't have any symptoms and they're spreading it to everybody else. That's what we were trying to eliminate.
Right,
Just because the
right,
kids
right.
aren't sick doesn't mean they're not spreading around. Have you ever watched kids when they're playing on the playground?
Oh.
Okay. What they're doing with everything, they're
Yeah.
picking their nose, their hands are in their mouth, they're picking stuff off the ground and eating it, they're kissing each other, they're hugging each other. Kids are filthy.
Pat, I had so many high fives and hugs and tying
And-
wet shoelaces. Trust me, I get it.
And
I
grown-ups
contracted
are
all
too.
that.
Okay, grown-ups
Yeah.
are too. We're a society that never wash our hands. We never cleaned up after ourselves. Do you know how many times I'm in a bar and I go in and I'm standing at the urinal and the guy next to me is using his cell phone?
Oh yeah, that's pretty
Okay,
disgusting.
it's we're a filthy society. I'm not. I wouldn't consider myself a germaphobe, but being involved with surgery, infection was 100% of the bane of my existence.
Oh,
okay?
absolutely.
So all we
Absolutely.
did is protect from infection. So I'm extremely knowledgeable about the things where there's a breakthrough. One of the biggest things, all the PPE that they were using, people weren't using it right.
Yeah.
People weren't wearing masks properly. How many people do you see walking around with a mask and their nose is
or
hanging
on their
out the
chin,
top?
just on their chin.
What,
say
their
they had it
nose
on.
is sterile and their mouth isn't?
Absolutely.
Okay, so-
Absolutely.
But again, another topic.
Yeah.
But you have with respect to immunity, there's such a multitude of things that contribute to an individual immunity. It's very complex to sort it all out.
Again, we've never faced that before, so we didn't know what to do. So we had to do something, and they were wiping down the doorknobs between classes while the class doors were shut. They were hand sanitizers were everywhere. Kids had to wear masks. I mean, they were trying to social distance the kids, but you might as well try to herd a bunch of snakes because
Well-
these kids aren't going to stay 6 feet apart.
I have a very good friend of mine who is a nurse. She was one of the nurses that she took care of the COVID patients. She was one. That's all she did at the hospital.
Yeah, I'm going to tap out on that one. No way.
Well, she did that every single day. She was compulsive about wiping down her workspace, wiping her computer when she'd enter things, wiping this, wiping that. She never got it. To this day, she hasn't had it. okay?
Wow.
She's like the only person I know that hasn't had it. I got vaccinated 3 times, and then I got it, okay? So she has never had it. And she's a smoker. So she was a setup. And I know at least 2 other nurses, same situation, taking care of these patients every day. They were very compulsive about the whole hygiene aspect, using the PPE properly. They never got it. To me, it's a little more than a coincidence. I think that if you did it correctly, you were going to protect yourself. And
Pat, you know
it was
what's
a panic, but I think we needed to do something because this country doesn't respond unless you panic them. They don't take you seriously.
Pat, you know what? I can only say to that, you are 100% right. As a police officer in a township, every time that we needed to pass a levy or the township needed more money, what did they say? The first thing to go is we're going to lay off police and fire. And everybody said, I'm passing that levy. I'm not going to let go without police and firemen.
Absolutely. I agree 100%.
So we
You
use
guys aren't
fear. We
paid
use
enough.
fear as a motivator, and I think that's, and you're right on. I think
had to.
we're both on the same page
We
with
had
that.
to. We couldn't do what they did in China, but go ahead.
Yeah. Well, we make up our own cocktail and send it that way.
No.
I guess.
I'm talking about
anyways, yeah.
the reason it didn't spread over there. When it first hit, you remember they stayed at 80,000 cases forever.
Right,
That's all
right.
that country of 1 billion people ever had. Why? Because they had guys dressed up in hazmat suits walking around with drones, and if you left your house,
You
they
were-
shot you.
Right.
Okay? They
Right.
made you go back in your house. You weren't even allowed to take your dog out. They had to have their dogs peeing in the house on mats. They would not let people out of their
Right.
homes. And you can't do that in this country. Okay? You
Absolutely not.
There's just absolutely no way you
I mean,
can
our
do
freedom.
that.
I will say this: our freedoms were infringed a lot through COVID.
Comparatively,
Right, wrong, or indifferently. Freedoms as we knew it in the United States, we definitely lost some freedom and independence.
Absolutely.
And I think people we're like, we're in the U.S. This doesn't happen to us, and we push
But
back.
it did. And
And
it
it
still
did,
is.
and we pushed back. But going back to, when we locked down these schools for a population that didn't have as high of an infection rate, we caused a lot of mental and emotional problems to these kids. I believe that. I think we're seeing that they're delayed in their learning. We've set them back mathematically, science-wise, whatever. But we also we didn't figure in, there were low-income students that depended on the meals that they received in those schools. They didn't have access to computers to do the homeschooling. So where did we throw them? I mean, reliance on a free meal program for a kid, that's a lot.
I hear you.
I've seen it firsthand. There were kids that, we fed and clothed as they came to school. They come to school wearing rags, and we would have them clean themselves up, give them fresh clothes, feed them every morning, feed them their meals. We are very fortunate. You and I are very fortunate, and many people are very fortunate. We live in great environments. We have great
Yes.
homes. We have great jobs. We live a good life. There are so many out there that don't, and I think that's
I agree. And
some of the problem that we didn't see coming with this. I mean, our reaction was kill the virus. Let's not let it spread. We didn't look past that and say, uh-oh, there are some falling through the cracks.
No, and the thing is, you're forced to make a judgment with information you don't have at the time you're making the judgment.
Sure.
Okay. No one.
Monday morning quarterbacks are always the best.
That was a story of my life as a surgeon, Bill. Okay. Everybody was always looking over your shoulder. Something didn't go well. You screwed up. Okay. Just get better. Okay. And we'll discuss that later.
I'll look for that the next time. It's a learning experience.
When you looked at where they were predicting this was going to go, I'm talking when it very first broke out in Ohio. You look at the numbers. All they were doing was there. I can't remember her name was in charge of infectious disease in Ohio, and then she resigned. But they were showing these curves of how many, and we put all these measures into place, and we flattened out on the curve in Ohio for a long time. We were way below the national average because people did it and people listened. It was kind of a panic approach, but the goal was to slow the spread, so we had enough time to get ready for it. That was successful. Are there casualties? Yes. Are there
Oh, yeah.
Are there things that are going to happen?
No
Are
plan
there
is
innocent
perfect.
bystanders?
Right.
Yes. But you know what? No matter what I challenge it, no matter what measures you would have put into place, somebody was going to find something down the road that said that hurt this person, that hurt this person, that hurt this group of people, that group of people. You can't have good without bad.
Well, Pat, we live in an environment where if you say something and you offend somebody, that's a criminal act anymore. Feelings are a big thing right now, but we'll get into that. That's a different show altogether.
I hear you.
Yeah. So just following up on this, there was an increase in several mental health conditions. Anxiety. This is based on private insurance claims and such. The most notable increases in mental health conditions included anxiety, which rose like 94%, depression, 83%, schizophrenia rose 61%, self-harm, which we're going to do an episode on suicide and how it affects people and those survivors. But self-harm ballooned 333%.
I can believe it.
Between 2019 and 2020. And substance abuse, obviously, we're going to numb ourselves to what's going on at 63%. Clearly, the decision to shut down schools and eliminate social interaction for the least vulnerable population, I don't think we gave it enough thought. I think we reacted to it a little too quickly. But again, I'm not in the medical field. You see it one way, I see it another way. I look at the
that's
the
fine.
emotional.
We can agree to disagree.
Yeah, man.
I mean,
Hey,
that's not.
That's what it's all about. I don't hate you because you think a different way.
I
There's
agree
no
with you
way.
100% on that.
But so I think, did we cause more harm than good? I'm going to throw that up, flip a coin. I think we're going to have a toss up on that one. We both have differing views, and I see the side effects that didn't go well. But on the other side, I see how it may have slowed, a lot or prevented a lot of casualties for sure.
That's where I am with it. But
Yeah. So and I get that. We did see a lot of inconsistent advice. You got to admit that.
well, you're always going to get that when you have something new. Okay, watch the stock market every day.
Right.
Okay, you
That's
got
why
this
I don't
guy saying
play.
buy this, and some guy says don't buy that, and then 3 days later,
Sure.
the guy who said buy it's an idiot, and the other guy's a genius. And no matter, whenever you're trying to make a prediction, you're going to have one of two things: someone's right, and someone's wrong.
Someone's wrong.
Okay, and you can't be both,
Yeah, yeah.
and you can't cover both bases. And when anybody's trying to predict the future, you're trying to time the market. You can't do it. You think you can. Somebody is going to throw something out there that's going to be right. You just don't know who that is.
Well, Pat, that's why we're in the middle of this episode. You don't know what you don't know.
Exactly.
We didn't know
You don't-
anything, and
no,
we were
didn't.
we were
And
flying blindly.
And you have to do the best with the information you have at the time.
But we went through a lot of different, like I said, the inconsistent advice, for whatever reasons, was don't wear a mask, don't wear a mask. Hey, stop buying these masks because we don't have enough for the medical field. So stop buying them, don't wear them, they're not going to help you. To start wearing a mask, wear a mask, keep wearing a mask. If you're vaccinated, you don't have to wear a mask if you're with your family. If you're unvaccinated, you should continue to wear a mask. Wear a mask outdoors if you're unvaccinated. If you're not unvaccinated, if you're vaccinated, you're okay to walk outside. Which, in my mind, if I saw somebody walking down the street walking their dog, it's just them and their dog, and they're wearing a mask, I got to ask why.
They're not getting it.
You're open. You're
Bill,
open
that's
air.
just they don't
Yeah.
understand. Okay,
Yeah.
and there's nothing. You're being a little overcautious in a situation like that. There's still people that are wearing masks. I see them out all
See
the
'em
time.
every day.
A giant eagle every day.
In the car
there's
by
someone wearing a
themselves.
mask. And they don't completely understand the whole process, but that's okay. If anything, they're erring on the conservative side. Okay,
Sure.
Wearing that mask is not going to hurt them. Is it going to help them? It might not, but it might. But it definitely isn't going to hurt them.
What about the continued, the breath that you're putting out there and you're sucking it back in?
Well, you have to realize different
Decreased
masks,
oxygen
different masks have different purposes. The mask that we wear in the operating room, the standard mask, is designed. It doesn't protect me at all. It protects the patient from getting anything from me.
Gotcha.
Okay, these COVID, the
N95s,
N95 masks, they
which nobody
protect
wore.
both directions. Well, they weren't wearing them properly. If you were going to wear those masks properly, you were supposed to go get fitted every time you got one, which I did the first couple times I got one, but then after that, it just wasn't practical to do it. It may not have been 100% necessary to do it that way, but different masks accomplish different things. Pulling your shirt up over your face is of no value whatsoever.
That's my next point.
And people
Many of
were
these people
doing
just
that.
Got online and bought something. It was
Wearing
a cloth
scarf,
mask.
yeah, and it's not going to be of any help. But you have to look. The other thing, you have to sift through some of this data and look through things a little differently. That I personally did. There's a site I would go to daily and check all the numbers when it first came out. For the first 2 years, I was on there every day. My wife would just make fun of me. What are you doing? And because I was out. And one of the things I looked at was you would see when certain things happened, you'd see blips in the number of cases. Okay, they told us all to take our masks off. It's okay to take your mask off. Okay, if you're vaccinated, you can take your mask off.
Oh, there you go. Because
Okay.
you can't spread it.
Right. Okay, but guess what? All the people who weren't vaccinated were still walking around with masks on, right? No.
Yeah, of course.
No, they weren't.
Well,
That's just it. The people who weren't vaccinated took their masks off too. So guess what?
The
There it
blip went
goes
right
again.
back up.
The
Sure.
masks worked. You want to know what worked and what didn't? The masks worked. We didn't have colds. No one got the flu. No one got a cold that first winter, because everybody was walking around with a mask on. I mean, the masks.
Well, and we
work.
were isolated too. Let's put that into
Isolated.
perspective.
No, definitely. And
Everybody
we're keeping our distances.
working from home.
And,
Yeah.
and I think those measures were effective. I really do. People were still getting it, but it's a virus. It's sneaky. They do that. No matter what you think you're doing, you might not be doing it quite right, or somehow it gets by.
Well, there's a reason these viruses persist.
Yes.
We haven't cured cancer. We haven't cured a lot of different things medically. So there's a reason for it, because they do mutate. They do react. to what we're
Some
giving them.
viruses are
So,
gone.
Yeah, some, thank goodness. But we
But-
haven't found a cure-all yet. There's a cocktail out there somewhere. We're going to find it eventually. Maybe not in our lifetime, but somebody will come up with something. There's a magical pill. So as we go through this, you could, if you were vaccinated, you can go to small gatherings, blah, blah, blah. And then it was, you didn't need to wear a mask, blah, blah, blah. That bounced back and forth so many times that I can't even keep count. There was so much inconsistency. I think we kind of lost a little bit of faith in our medical experts. I don't want to mention anybody by name, but he was a doctor.
I agree. People,
And I think
Ag-
politics,
again-
I think there was political push on that to go a certain way to kind of keep the country going in a certain direction. I don't think he was a neutral. I don't think he was just a practicing doctor, and I don't think the CDC was as effective as it could have been. And I think by their own admission, they did some things wrong, looking back at it.
Well,
But again,
of course,
Monday
they're
morning,
looking back at it.
Monday morning,
And
right?
no matter who was in those positions was not going to get out of what they were doing without getting some egg on their face. I said that right in the get-go. I would not want to be any of these people because 2 years from now, we'll be telling how many things they did wrong, which is exactly what
Well,
everybody's
that's why the
doing.
lady in Ohio
Okay,
stepped down.
everybody's perfect 2 years later. Okay,
Sure,
and it just,
sure.
like I said, you can really get my blood pressure up about that because I was as
Oh,
a
I'm working
career
on
as
it.
a,
I'm
as
working on
a,
it,
as a
Pat.
career as a surgeon, everyone was always looking if something didn't go perfect.
It's you.
It-
Yeah, it's your
and-
fault. It's your
and
fault.
Always looking at this is what you should have done, and like I said, that's another topic.
There are a lot of different views on vaccination, and I mean, there's reasons some people didn't get it. There's reasons some people did get it. That's their own personal choice. I never.
To an extent.
Yeah. Yes and no.
Well,
I mean,
My whole thing with a vaccination is if I get a vaccination and you don't, you're the one that's going unprotected. That's your choice. If you want to take that chance, I think that's fine. My brother didn't want to get vaccinated. He still doesn't get vaccinated. He just didn't believe it was necessary. He's healthy enough with his diet, his immune system. Fine. And then if something happens to you, I'm not going to, I'm going to feel bad. He's my brother, but at the same time, that's your choice. However, you have to look at who does it affect if you don't get vaccinated? Does it affect you and you alone, or does it affect somebody else? Now, most of the people, let me just give you an example. If you're in healthcare and you choose not to be vaccinated, okay, you are affecting other people.
Sure, you're gonna transmit
not
it to
just
other
yourself.
people if you-
Not to
yes.
mention, let me give you an example here. My father took ill and got sick in the middle of all of this and had to be put in first he went into rehab. It didn't pass the rehab, so he wound up in a nursing home. And he's in an extended care facility where we had to wear masks and sign in and get our temperature taken every time I went to visit him, okay? Because we were still in the stages where you had to have PPE on if you were in this facility. Everybody in the facility, well, people who were working and who weren't. Well, there were some of the healthcare workers at that facility who chose not to get vaccinated. And then one of them tested positive for COVID. And then what did they do? When the one person tested positive for COVID, they shut down the entire facility, no visitors for 2 weeks because
Right.
of one person's personal choice. Okay? Now,
Sure.
if your choice is going to result in now we have 200 people here who can't see their loved ones. My father's dying in a nursing home and I can't go see him because someone
And
else's personal choice. It's no longer personal.
Right.
And that's my point. You have
Right.
to look at it within the situation that you're in. That is a selfish choice. If you don't want to get vaccinated, then don't be around sick people and don't be around compromised people who are more likely to get this. And
So
don't put
again-
other people at risk because of your choice. I don't care what your choice is.
It really comes down to what is your role? Where are you at in society?
Exactly.
If you're playing a role in a medical facility, obviously you would want to
That's
take
different. Right.
If you're,
My brother, he's doing work from home. He doesn't want to get vaccinated. Okay.
I'm in my own home.
you're-
And there were some reasons for. I mean, there were some legitimate reasons. I know when they first came out with the vaccinations, what it created myocarditis or something. They thought, or a clot shot. Why'd they call it that?
Bill, there has never been a vaccine in the history of mankind that hasn't had some negative side effects, and there have not been some people that died when they got it. Okay, from everything from
Right.
eggs in the serum to whatever. Nothing
you
is
can
100% safe.
But you can agree with me, with as much fear that was centered around this pandemic and this virus, that just added more fuel to the fire for people that were on to go, hey, I don't know if I want to get this
Well, it
vaccine.
did. Plus, it was produced so quickly. Okay, that
Right, we
made
were-
everybody very apprehensive.
It was an emergency release on this thing. It
And like I
wasn't
said,
even clear.
it's a calculated risk. I personally, as I said, I was in healthcare. In my opinion, I didn't have a choice. This affects other people. I want protected. I did it. The other thing I looked at is, when I went to med school, there were a lot of people in my class in med school, and I remember the students, and I remember the people that were the top of the class. and they were off the chart smart. And you know what they did? They went into research, okay? I trust those guys and I trust those women because they were so freaking smart and they had nothing but good intentions in heart, and they were not malicious people. People in research, they don't make a lot of money as far as a doctor goes, not compared to people out in private practice and doing things like that. So they didn't do it for the money. They didn't do it for the fame. They did it because they have
they're not paying all that malpractice that you had to pay either.
Well,
yeah, right.
Yeah, honestly, that's funny. I looked just as an aside, I just got my personal health care the other day. You know, my personal health care now for my family is more than my malpractice was, okay, on a yearly basis.
On that note,
Anyway.
let's go into our next segment we like to call reaction time. All right, this is going to get your blood boiling for sure. All right, Doc Patchen, with more than 3 decades of medical experience, here we are in 2023. Right, we're starting a new year, new me, new us, and still at the mercy of this COVID-19 and its friends like Omicron, Delta AY 4.2, Alpha, Beta, and whatever other vegetable soup they want to throw.
They're all,
whatever
every day they get a new one.
They want to throw at us. What do we do now? That's an open-ended question. What do we do?
Well, again, you're trying to predict the future. I can just tell you from what I know about
But you're a
virus.
smart guy.
I can tell you from what I know about viruses. This virus will continue to update itself, whatever you want to call it, evolve, mutate, and it's going to continue to do that at some level.
So do I take 4, 5, 6 booster shots?
I would say yes, just like we recommend having a flu vaccine every year because the flu virus changes every year. No one seems to have a problem with that. I personally, they haven't said it yet. This is just speculation on my part. I think we're going to have to get some type of a COVID vaccine on a yearly basis, just like we get a flu vaccine every year, because I think there is just the potential for this particular virus to continue to change over time, at least for the immediately foreseeable future. And because you don't know when those changes occur, if it's going to become a more dangerous situation or less dangerous situation, I tend to err on the conservative side.
So do we start masking on planes again? Do we start requiring a medical card?
No, because the other thing you have to look at with this is we're still having 30, 40,000 cases a day of COVID in the United States. Okay, that's not at its peak. Its peak, it was the highest. It was like 900,000 in one day.
Sure.
Okay, but even those numbers were later, not with the original outbreak. And what you have to look at is how sick is this making people? Okay, it's still between 5 and 10 times worse than the flu as far as a percentage of people that die that get it. Okay, the flu, like 0.1% of people die from influenza every year that get it. 0.1% of the people that get it will die from it. COVID,
But most of them probably had an underlying condition too, right?
Yeah, well,
I mean,
almost
I think
all of, yes, but
yeah.
I'm comparing the same population with both, so the numbers you can
Sure.
compare. But COVID, at its highest was about 1.5% of people died versus 0.1%. You're talking about
That's a dramatic. I mean, there's a difference. I
and
get
it's
that.
still
Yeah.
it's still higher than the flu, but it's not like it was. We're not at that 1.5. We're more like at 0.3, okay, instead of 0.1. So we're getting the numbers.
So does healthcare feel like they have a handle on this at least?
Exactly. If you don't have the number of people dying from this, just wiping out, with the potential to wipe out the society as you know it, there's no reason to behave that way and shut the whole planet down, okay, which is what you were getting before. No, you don't need to do overkill. Right now, based on what we have at the present time, no, you don't need to start wearing masks and doing everything again. Could that change? Well, yes, it could change, and we have to adapt as a society and understand that nothing is static. This is not a static issue. This isn't just how it's going to be. This isn't going to stay like it is. It could hopefully get better. It could still get worse, but it's 6 months from now, it's not going to be the same as it is today. Exactly where we are 6 months from now, honest to God, I'm not an infectious disease specialist. I'm probably the least qualified to make that prediction, but what I can predict, I can't predict what it's going to be, but I tell you what it isn't going to be is it won't be the same as it is today. That's the only thing that I think anybody can predict with any accuracy is what we'll be dealing with in 6 months is not going to be the same as in June is not going to be the same that we're dealing with in January. What will we be doing different? it's going to depend on where the trends are going. And you have to look at what's going on in other countries, see what they're experiencing. Even though it is a pandemic and experience worldwide, it's compartmentalized. So when you see something happening in India and all of a sudden they're spiking and we find a new variant, okay, it's a small world. It's going to get here.
Sure.
Okay, so when you see what it's doing there, then you got to take the appropriate precautions here.
Well, I think they're taking
based
precautions
on,
right now. I think flying out of China, they have to take a COVID test within
'cause
2 days.
Right. Well, you're not allowed to fly into China without a COVID test. Again, had to change that. Okay, but it's restricted. It's not everywhere you go. If you're going to fly into China, why? They're having a problem.
Yeah.
Okay.
I don't
First
know
of
why
all,
you would want to fly there.
Exactly. That's another
Personally,
thing.
that's
But
ridiculous.
You have the right. Your freedom. Okay?
Yes, sir.
You get your
Yeah.
freedom infringed upon. I want to go to China. Okay, fine, but then stay there when you get there. Okay.
Yeah, that was
until
a
you're
big
safe
thing.
and you're not infected. If we have to, as you said, you don't want to have anything looked back on and say that was inappropriate, but you're still taking a chance with that, no matter what you decide. And I think it's honestly, I think it's unfair to expect exactness in any kind of a prediction. There's still a lot of things we don't know about this. We may 10 years from now, hopefully know more than we know now. What if we don't? What if we're still where we are today or close to it?
So
I don't
instead
know.
of putting on our body spray, we should bathe in hand sanitizer, rub down,
Well,
mask up, and then isolate ourselves. I mean, I don't know where we go. I don't know what it is we should be doing. Obviously, being more cautious, pay attention,
Absolutely. We
be
need-
educated about what's going on.
Yes, and have better hygiene overall. One of my biggest frustrations is when I go someplace and I see they've got the hand sanitizer and you go to use it and it's empty.
Yeah.
Okay.
Well, we did the cosmetic thing. We're showing you that we want to be responsible, but we're not really being
and
responsible.
because I've always liked to use hand sanitizer. Okay, I pet my dog, I go wash my hands. Okay, the
Pat-
little guy's great, but
Pat said he's not a germaphobe. Okay, I'm just going to go on that.
Well, hey,
but
I
let's
could
talk
tell you-
about the elephant in the room, though. Let's talk about the elephant in the room.
okay.
This was a man-made virus. Yes, I could see in your eye, Pat. It was a man-made virus.
They were
for
tinkering.
ill intent.
Well, I don't see. That's the thing that you're never going to get a straight answer on. This is definitely something that I think they were tinkering around with in a lab, but exactly what they were doing in the lab. Were they doing true blue research on this? Were they trying to create something to create a problem? There's all kind of speculations about conspiracy that they did this. They released it so the whole world would get sick, and they secretly had some kind of a vaccine that they gave
Countries
people.
for years used it.
and
Used viruses and stuff
Germ
militarily.
warfare.
Yeah.
Germ warfare. Anthrax is the perfect organism to do that with, by the way. I've been lecturing to my students about it. But
Why don't if they can make this in a lab, why can't they make the antivirus
well,
for it?
they have. The thing is with any vaccine, when the vaccines are targeted for something very specific about a virus, and when that virus changes, the targeting's off. Okay, and it's close, but it's not exactly the
So
same
they let
purpose. It's like-
Pandora out of the box.
They did,
Yeah,
and
yeah.
it actually there's some speculation it might even come from like a bat population. I mean, originally this was not originally a human virus, and I read a very interesting article about that where they think it came from a bat virus. And in China, I guess bats are on the menu pretty regularly.
Oh my,
there's some
yeah.
stuff that maybe they have an immunity from what they were eating. That the rest of the world didn't have. And I said,
I'll
that's
stick to a
it's
good
pure
filet any day of the week.
yeah, I don't eat any of that anymore myself, by the way. But
Oh, that's
exactly
right. I
where
did hear.
it came
You went
from.
vegan,
Yeah,
right?
Yeah.
How's that working?
I like it. Works for me.
Good. You look great, man. You look great.
Works for
I
me.
did just hear that, and I think your son told me that. I thought, good for you, man.
But
I stayed traditional, and that's why I'm as round as I am. So I'm going to stick with that.
there's plenty of chunky vegans out there. Don't worry. You can get plenty of fat on avocados and olive oil.
I'm going to go away from that. All right, we're going to go into our next our next segment. This brings us to our next segment. We like to call it a 365 recap. All right, Safety 365 recap. So we've kind of provided timelines of how things happened, what took place, what stipulations we were under by the government, and where we're at by the so-called expertise of the experts, or ineptness, however you want to look at it. That's Monday morning quarterback in here. But if you're immunocompromised or suffer from other medical conditions that make you susceptible to contracting this or other diseases, me personally, I think you should take all necessary precautions to protect yourself. I mean, that just makes sense. If you want to mask up, socially distance, or even isolate yourselves, vaccinate, that is your choice. And I think we've established that we're a little on different side. I think our goals are centered, but we feel a little differently and stronger on issue on both sides. Whatever it takes, all I can say is at the same time, my belief, if you're of normal health, you're not in specific populations where you're taking care of the elderly or in the medical field or specific fields, and you're free from interference, I think it's important that the choice remain yours. I'm not anti-vax. Don't get me wrong. I'm not anti-vax. I believe we should be free from interference. We should be free from mandates, and free from control over our independent thought. I think we were born to be able to make our own choices, educated choices.
Okay.
And I will say this. I say this openly to ensure that all our listeners understand. I'm not anti-vaccine nor anti-mask. I am anti-mandate.
Okay.
That's me specifically. Each of us were born to be free-thinking individuals so as to complement society with our unique gifts and our unique thought. So that's kind of where I like to leave that at through our Safety 365 recap. I'm not as educated as you are in the medical aspect. I come from more of a school of hard knocks. I kind of rolled through the streets, rolled around with people, fought with people, and got, by God's grace, I'm still here after 33 years. So I like to just leave it at that, kind of saying, this is where we got to through the mandates, through the shutdowns, through the isolation, through the hand sanitizer, through the best we could muster to make sense of this. And, we're still here.
Yeah, exactly. And, with respect to the mandates, mandates are created. Our government, the main function of our government, you got to protect people who might not be able to protect themselves.
Right, yeah, good point.
And there may be a lot of people that need mandates for that reason, because there's no one, the people that are
common
free
sense
to,
is not so common.
No, but and the people that are free to do as they do, they're going to win out. They could, their activities, even though it may seem individualized on the surface, it could affect those people who can't protect themselves.
Like a ripple effect.
Exactly.
Sure.
And so what if you're elderly diabetic on dialysis? So now you can't leave your house, you can't go anywhere, because there's people out there who are choosing not to be vaccinated. The vaccine doesn't protect 100% of people. I told you, I got all three and I got COVID anyway.
Right.
If that happens to that person, they will die.
I think
And
a lot
if
of
you
people
give it
see
to
that,
them-
though, because we were told at one point, if you get the vaccine, you don't have to worry about it.
No, you don't.
Uh,
Well,
I
you're
mean,
right.
They
You're
did
right.
tell us that, and then the
No,
same
you're-
people telling us that ended up getting COVID.
But you don't. There is pretty firm evidence, I think, today to say that even if you get it after you're vaccinated, it's not as severe. The illness is not severe. The
It's like wearing your
viruses offer you
seatbelt.
some. Well, yes.
You wear your seatbelt, it can
Yes.
save your life. But there are people that have died because they wore their
And
seatbelts.
I've
It goes
never-
both ways.
Personally, I never took care of one of those in 27
Right,
years. Okay.
right.
And also, there are people who are in bad accidents without their seatbelt on, and they live too. It's just like
There's
just
a
like
higher
anything
power,
else.
Pat. There's a higher power, and I think that's why we're still here.
Well, mandates, it depends on how far back you want to go with that too. Your kids not allowed in school unless they've had their MMR and their, okay?
Measles, mumps,
I
still got a shot. I got a mark on my arm.
Okay, and I got this, I'm old enough to have had the smallpox vaccine. Okay, my wife isn't. She fell right on the curve there, right on the
Gotcha.
deadline.
I still have it.
So I don't know. I don't, mandates, if a mandate exists to protect people who can't protect themselves, then I may lean more toward it than against it. Anytime you have the government interfering too much, it's a problem, but who draws that line?
I'm from the government.
There's
I'm
too
here to help.
much.
All right.
Exactly.
Well, I'm getting signed out here. They're telling me running long on time, but I can
Okay.
talk to you all day about this. We're going to have you back. We'll talk more
Okay.
for sure. Dr. Pat Patchen, man, I can't thank you enough for coming
Glad
down
to
here and
be
helping
Like
us
I said,
out.
Little out of my area, but
No, this is exactly
I
right
did
in your
take care
lane.
of these people too. And I'll tell you what, it called our bluff as physicians. When when a pilot's in trouble on the airplane, his ass is on the line too. As a doctor, generally that's not the case, but this was. So
Yeah, sure. They had a lot of
And we
tough
kept
decisions.
going.
A lot of tough decisions to be made.
I wasn't in the line of fire like some of those nurses were. They are the
God
true.
bless. They are heroes for sure.
Absolutely.
Planning ahead, just kind of looking ahead here on our next episode, we'll be discussing the very serious topic of suicide with Vince Brancaccio, the CEO of the Help Network of Northeast Ohio. I'd like to give special thanks to our show sponsors, Bolo Stick LLC, the door barricade device, providing safety and security to homes, schools, churches, and business locations across 42 states in the U.S. and internationally in 6 countries. Visit them at www.bolostick.com. And our new sponsor, Threat Extinguisher. Don't just see a threat, extinguish it. Visit them at www.threatextinguisher.com. If you'd like to be a guest on the show or have your business advertised as a sponsor, go to safety365.us and contact us via email, podcast@safety365.us. Let us know you want to be on or help us out, and we'll be happy to get back to you. And as always, a special thank you to the Trumbull Career and Technical Center for making this podcast possible. For Safety 365, I'm Bill Barna reminding you to be aware, be proactive, and stay safe.
Thanks, Bill.